How do lymph nodes protect against colon cancer spread? Imagine your body's immune system as a vigilant security team constantly patrolling for threats. Lymph nodes are like checkpoints along the body's lymphatic highways, acting as filters that catch and trap harmful substances, including cancer cells that might break away from a tumor in the colon. These small, bean-shaped structures are strategically placed along lymph vessels, which carry lymph fluid filled with immune cells throughout your body. When colon cancer begins to invade nearby tissues, some cancer cells can enter these lymph vessels and reach the lymph nodes. Once there, the lymph nodes spring into action, using immune cells like lymphocytes and natural killer cells to recognize and attack these abnormal cells. This process helps contain the spread, acting as a barrier to prevent cancer from traveling further into the body. However, the story is more complex than just trapping cancer cells. Sometimes, cancer cells that reach the lymph nodes can develop ways to evade immune defenses. They might increase certain proteins that suppress immune attacks, allowing them to survive within the lymph nodes. If these cancer cells escape immune control, they can continue to spread, potentially reaching distant organs like the liver or lungs. This is why the status of lymph nodes becomes so important in diagnosing and staging colon cancer. When doctors examine tissue from the lymph nodes, they look for cancer cells. If they find any, it means the cancer has started to spread beyond the colon, which can influence treatment plans and prognosis. During surgery for colon cancer, doctors often remove nearby lymph nodes along with the primary tumor. These nodes are then carefully examined in pathology reports to see if they contain cancer cells. The number of affected lymph nodes and the ratio of positive nodes to total nodes examined help determine how advanced the cancer is. This information guides decisions about additional treatments, such as chemotherapy, to help prevent recurrence. In summary, lymph nodes serve as critical immune filters that trap and fight cancer cells, helping to prevent the spread of colon cancer. But when cancer cells find ways to bypass these defenses, they can facilitate metastasis, making the assessment of lymph node status essential for accurate diagnosis and effective treatment planning. Always consult healthcare professionals for personalized advice and detailed evaluation of your specific situation.